Glaucoma is the second most cause of visual loss in the world after cataracts. It is estimated as per the WHO, the amount of people with glaucoma is expected to rise up to 111 million by 2040. Glaucoma is mainly because of a progressive optic neuropathy with a characteristic nerve fiber layer loss corresponding to visual field defects, which may or may not be associated with a raised intraocular pressure. The raised intraocular pressure is very important here. Intraocular pressure is maintained by the aqueous humor which is produced by the ciliary body in the eye. This aqueous humor production and its drainage are very important in the disease of glaucoma. Either there will be increase in production or there is an increase in obstruction to the outflow. Glaucoma is mainly seen in patients with a positive family history of a hereditary and a genetic related disease with the family members, grandfathers, parents, other siblings who are affected with this disease. It is also seen in patients secondary to diabetes, thyroid, hypertension, and people who use medicines, drugs, especially corticosteroids, neuroleptics, and it is also associated secondary to trauma. The glaucoma is also present in children by birth, which we call it as congenital glaucomas. Glaucomas are early treated with the eye drops. There are different varieties of eye drops which act at different levels. The main problem with this glaucoma disease is by the time the patient realizes that he is having a defective vision, especially the vision decreases from the periphery to the center, and ultimately he will get a tunnel vision and he will lose the vision completely. By the time the patient feels that he is having symptoms of glaucoma or he is having visual symptoms, he is already 40% lost his nerve fiber layers, and the greatest concern here is these nerve fiber layer loss is very irreversible. So early detection of glaucoma and diagnosis and putting these patients in these eye drops, which are usually targeted to decrease the intraocular pressures. If the patient is not responding with the with the eye drops targeted for the IOP, these patients are again shifted to surgical management. There are different procedures in this surgical management. The most commonly done is a trabeculectomy, and recently we are using anterior chamber stents and posterior segment intravitreal valves for the drainage of the aqueous humor. So early detection of glaucoma is very important concern in order to prevent a gross visual loss in these patients.